Today, I'm going to share with you the connection between sleep and cognitive health, including a discussion of why sleep is important, what happens in your body while you sleep, how much sleep you need, and what may be negatively impacting your sleep. Sleep is strongly associated with cognitive health, and poor sleep may be both a cause and a symptom of Alzheimer's disease. Many cognitive functions, including attention, memory, language, and reasoning, are affected by sleep. Some studies estimate that 15% of Alzheimer's disease may be attributed to inadequate or poor sleep. Both the quantity and quality of sleep are important for proper brain function. Sleep deprivation can increase risk for a variety of medical conditions, including poor cognitive function. Poor sleep quality is associated with faster cognitive decline and an increased risk of dementia. Researchers have suggested that a wide variety of cognitive functions are affected by a lack of adequate sleep, including attention, memory, language, and reasoning. Sleep is a critical time for the repair of neurons in your brain, which are the important cells for the transition of information within the nervous system. When you go to sleep, many of your body's systems slow down. Your heart rate slows, your blood pressure dips, and your body temperature lowers. However, your brain is very active. Neurons in your brain use more energy than any other tissue in the body, and the core function of sleep is to repair, reorganize, and maintain your brain's neurons. Sleep is important because it facilitates memory consolidation and learning new material, while it also helps save new memories into long-term memory storage. In fact, research has demonstrated that taking a short nap before learning new information may help the brain support memory consolidation. Sleep is a lifestyle factor that can be affected by many different stimuli and health conditions. Finding natural ways to improve your sleep may be important for reducing the risk of Alzheimer's disease. Most adults function best with 16 hours of wakefulness and 8 hours of sleep at night. Getting at least 7 to 8 hours of uninterrupted sleep is important for health. However, for many adults, that is not always easy. The ability to sleep 7 to 8 hours at one time may decline for some with age. Approximately 25% of U.S. adults report getting insufficient sleep at least 15 out of 30 nights. According to the American Psychological Association, 60% of adults report having sleep problems a few nights a week or more. A person may be having difficulty falling asleep or staying asleep during the appropriate time of day for many reasons. For example, if you go to bed or get up at different times throughout the week, it is hard for your body to establish a sleep rhythm. Thus, it is important to go to bed at the same time each day and get up at the same time each day, even on the weekends. Medical conditions that cause pain, such as arthritis, may make it difficult to get comfortable to fall asleep or stay asleep. Also, sleep disorders such as restless leg syndrome and sleep-disrupted breathing, including sleep apnea, are associated with sleep difficulties. Finally, decongestants, steroids, and some medications for high blood pressure, asthma, and depression can cause sleep disruptions as a side effect. More than 70 million Americans are affected by sleep disorders, with up to 1/3 of Americans having symptoms of insomnia. In fact, over 20 million Americans suffer from sleep apnea, which is similar to the incidence of diabetes and asthma. Sleep apnea increases the risk for stroke and heart disease. Only a fraction of the people who have sleep apnea have actually been diagnosed or treated. Your body requires food and water to function properly, and has created the mechanisms of thirst and hunger to alert you to these basic needs. Likewise, your body requires sleep in order to function properly. However, sometimes it is easy to overlook the basic signals of being tired, which leads to sleep deprivation and can result in the following symptoms: needing 4 to 5 cups of coffee to make it through the day, drowsiness during the day, frequent yawning, difficulty keeping your eyes focused, trouble staying alert, falling asleep immediately in bed, excessive daytime dreaming and wandering thoughts, increased perception of pain, memory problems, frequently sleeping in on the weekends, weakened immune system and getting sick more often, and depression and anxiety. A decrease in just 90 minutes of sleep can reduce your alertness by 32%, which can impair memory and cognitive abilities. Other effects of sleep deprivation include high blood pressure, heart attack, heart failure, stroke, obesity, psychiatric problems including depression and mood, attention deficit disorder, mental impairment, injury from accidents, and poor quality of life. Fatigue can be the result of frequent mental and physical exhaustion during the day. Increased fatigue often leads to irregular sleep patterns and sleeping during the day, which will interfere with your ability to fall asleep and stay asleep at night, which creates a vicious cycle of sleep disruption. As you have learned, inadequate sleep negatively affects cognitive health. There are multiple causes and symptoms of inadequate sleep, including depression, seasonal affective disorder, and others. Alert your primary healthcare provider if you experience daytime fatigue or difficulty sleeping at night, including snoring or gasping for air in your sleep. A doctor will need this information to determine what is causing this disrupted sleep and how to determine treatment choices. Now that you recognize why sleep is important, what happens in the body while you sleep, how much sleep you need, and what may be negatively impacting your sleep, it is time to explore the steps you can take to improve your sleep habits and environment in our next video.